President Obama has been using religious language in an attempt to draw support for his health care legislation. Just last week, the president had a conference call with faith-based groups in which he said, "We have an ethical and moral obligation to look out for one another." Well, this brings us to the subject of tonight's face-off. Should the president be injecting religion into the healthcare debate? Joining me now from Baton Rouge, the president of the Family Research Council, Tony Perkins, and from Washington, the president of Sojourners, a Christian social justice organization, is the Reverend Jim Wallis. We're going to get started first. I want to play some of that sound from the president, and I want to get both of your reactions. Tell me what you think about this.
What I consider a core ethical and moral obligation, that we look out for one another, that I am my brother's keeper and my sister's keeper. And in the wealthiest nation on earth right now, we are neglecting to live up to that call. I need you to knock on doors, talk to your neighbors. I need you to spread the facts and speak the truth. There are some folks out there who are, frankly, bearing false witness.
I am my brother's keeper, I am my sister's keeper, bearing false witness. I mean, this is straight out of the Bible. Jim, let me have you take it first. What do you think of this? And I understand your group actually helped arrange this conference call, right?
Yeah, 140,000 people joined the call. About 300,000 people have listened since, so it was a big call. Lisa, there's a long and good history of this, from the abolition of slavery, women's suffrage, the civil rights movement. People who talked about moral values have often really helped to make change. Change is scary, and especially in uncertain times like now, and a nation doesn't change until we choose hope over fear, and the religious community can help with that. Now, that being said, there is no right religious position or bill on health care reform. You know, God didn't send down Moses from Mount Sinai with a final bill passed out of committee. It was 10 Commandments. But nonetheless, there are moral principles, I think biblical principles, like God's will is for health and not sickness. And when we are instruments of bringing good health, we are doing the work of God. And right now, we have a system that is fundamentally broken. So many people are hurting, they're left out, left behind. Even if they have insurance, they can't afford good health. The system is broken, has to be fixed. How to best fix it, I think, should be what we focus on in a sane, reasonable, healthy, and I think, yes, a moral debate.
All right, Tony, does religion have a place here in this debate on Capitol Hill?
Well, Lisa, I think increasingly Americans have little faith in the government, in the president's proposal here on health care, and I think he's trying to inject faith into this discussion to try and bolster its support. Now, I will say I agree with Jim. I think we have a long history in this country of faith playing a very key part in the development of public policy and bringing about change in this country. So there's no problem there. It's the inconsistency. You know, on one half, the president is telling one group like Planned Parenthood that reproductive health care will be in his proposal, and then he's talking to the religious left group saying that, you know, that those that are saying that that's in there are bearing false witness. I think the president needs to go back to what we taught kids back in Sunday school about be careful, little eyes, what you see, and be careful, little tongue, what you speak. Because even the AP and members of the president's own party are saying that he's not being forthright, that abortion would be expanded and paid for with taxpayer dollars in this bill.
Jim, when I heard President Obama made those comments, I thought that it sounded like they were taking a page from President George W. Bush, that they were essentially trying to get Christian groups to rally around him and to cast this in a moral, in a moral aspect somehow, that we have a moral obligation to do this. Is this essentially ripping a page from the previous administration? Do you think this is a genuine effort, and do you think the public will see it that way?
Well, I know President Obama is himself a person of faith, and I think this is right from his own heart. But let me speak to what Tony said. Tony and I want to take abortion off the table here. There's a consensus in the faith community that federal funds should be prohibited from paying for abortions in a health care bill. That's where we have to go. Are all the bills clear on that now? Not yet. They're making progress on the Hill. We're not there yet. But I'm committed to making sure that the rules aren't changed. The president has said that he doesn't want federal funds to pay for abortions. You shouldn't have to pay for somebody else's abortion, and you shouldn't even pay for your abortion with public funding. Now, I think Tony and I should agree on this, because Good health care reform, if we do this right, this could reduce abortion in this country. And all of us, pro-life and pro-choice, ought to agree with that. Good health care, giving women better health care, will more likely enable women to carry their child to term. So a good health care reform could reduce abortion in this country, and I'd love to see that.
Tony, should the government have a role here, a government-run health care system, or at least a greater participation?
Lisa, I think that there is a problem in health care. I mean, I've written about this in the book that Bishop Harry Jackson I published last year. Health care reform is a top issue that the church should be involved in solving. But it's not going to be solved by the government taking it over and taking away certain choices from the American people. I do think the government has a role to play here. I think we can talk about changing certain laws to cover some of those uninsured, range anywhere from 20 to 40 million Americans. Some of those are in between college and working. They could be put on their parents' policies. We could allow pools to be gathered across state lines to increase the pulleys and depress the cost. But the issue here, we really can't have that discussion because, as Jim mentioned, you know, if we could take the issue of abortion and this end-of-life counseling off the table, we could have a legitimate discussion over health care. But the president has refused to let his yes be yes and his no be no, to borrow a passage of Scripture, and say, all right, I'll accept one of the dozen amendments that's been offered in committee that would say no to taxpayer-funded abortion. He's yet to do that, and I think until he does, we can't have this discussion.
All right, Jim, you get the final word. We're running out of time here, though.
You and I know that there's a lot of fear and confusion out there, and there are a lot of lies being told. Falsehoods are being told. I think we have to commit ourselves to a debate which is honest. And most Americans don't want government bureaucrats or healthcare industry bureaucrats dictating their coverage. Doctors, patients, families, faith communities should have a choice about their health care, but more people need good choices. That's what good health care reform will be.
Well, the
president wants that. I think he wants that, and you and I need to help have the good debate. You and I, Tony, need to talk about how things like death panels and euthanasia, all these lies, are not letting us have a good debate, a sane debate, a rational debate, a civil debate, and a moral debate on health care reform, because we need it. We really need it.
Okay, we're going to have to continue this discussion a little later, but it certainly is a lot more to discuss. Tony
Thanks,
Perkins,
Lisa.
Really appreciate your joining us, and the Reverend Jim Wallis. Always a pleasure. Thank you, gentlemen.
Thank you. Thank you.